My guest, just in case you've just tuned in or you're watching this as another part on YouTube, my guest is Dr. Tom Godwin. He was part in 1962 of the very first cardio clinic, or whatever you want to call it, in a hospital in the world, Toronto General Hospital, which went on, and everybody in the world copies what they did at that time. And back in, I think, our segment 3 of this series of segments, he talked about the ECGs and what they were doing, and being an intern in the hospital or resident, and getting called because the nurses, if the pen's stuck on the ECG machine, he had to be called, as only a doctor could unclog the stuck pen or something or other. And that's another thing that's a little bit wrong, is that we put labels, or we make some people have to do things,
yes,
that where somebody else could do it.
We should make far better use of practical nurses, you know, and nurses' aides, and paramedic persons. You don't have to be a doctor to put a cast on. In fact, the cast orderly does a better job than the orthopedic resident putting a cast on, you know.
Well, they get in Lionsgate Hospital. We've got a fellow down there, and I can't remember his name, president of the BMW motorcycle. And I apologize for not remembering your name. I've known him for years, but he's just a genius with a cast.
Yeah. And everybody develops skills if you get to do them. So I think that that's one of the huge problems. I mean, nurse practitioners in small towns. I mean,
yes,
we should do that more. And another huge problem, I think, is that the general practitioner now in Canada has been downgraded, and so he wasn't making as much money. If the general practitioner was very conscientious and had an older practice, the patients were older, working 50 hours a week, they made less money than a head nurse after they paid their office expenses. And I think we have to change that, because now so many of my friends can't even find a family doctor. And then they go to a walk-in clinic, and every time they go, it's a different person. And then if they get sick enough that they have to be admitted to hospital, a hospitalist ends up looking after them. And then when they get discharged from the hospital, where do you send the letters to? You know, so there's the continuity is really poor. In the old days, when the general practitioner looked after the family, he would know things that went on in the family that would have a great bearing on the person's health, and that's lost, and it shouldn't be. The GP should be put back in the system. It's a crime, and I saw it all happen when I first started practicing as a cardiologist. Specialists like me were basically invitees into the hospital. The general practitioner looked after the patient, and if they thought, gee, this fellow needs to see a neurologist or a cardiologist or a respirologist, somebody looking after the lungs, or something wrong with his kidneys, they'd call a nephrologist, But the GP was the coordinator. Now it's not like that at all, and I think that's a big shame, really. And it would be cheaper, I think, to get the GP back in the system big time, because then we wouldn't lose that continuity, and that's really the most important thing.
It's having a doctor that you can go to, and it's the doctor's receptionist that's the most important person, and you know that.
That's true.
Thank you, Dallas. Obey it, because if the doctor's receptionist recognizes you and so on when you phone, they're the ones that get you in when you want to be there and do it. So one should always take flowers to the receptionist.
Yeah. Well, it's really nice, though, when the family doctor in the old days actually came to your house, because then he could see that no wonder this kid has asthma. There's 6 cats in the house and that sort of thing. Or this poor lady, she's not falling down the stairs all the time.
No, I got to remember to show Jane this little segment, because she lives downstairs with 3 cats, a hamster, and a rabbit in her room.
But does she have allergies too?
Oh, yeah.
Yeah, see, because lots of people don't have
But what
allergies.
I have I've got an electrostatic air cleaner for the whole house, and her room has another private one for her room as well. So, well, that seems to take out a lot of the stuff.
Yeah. Well, that's good if it works, because it's having hay fever or asthma related to a pussycat.
Well, so many kids have asthma now that didn't have it, but
I know. That's out of my field, but there's lots of very interesting theories about that. But anyway.
Okay. What other part? And because again, as I'm embarrassed, as you know, I've read part of the book,
Yeah,
and I
yeah.
did I think a fairly good job of talking to you about the parts that you read,
Yeah.
that I read.
Yeah.
But I didn't see the book until you got here today.
No.
If we had to take another part of this book in 4 minutes, what part would you want to get across to people most?
Well, one of the things that I wanted people to realize that we are born with certain traits, and unfortunately, some of the churches come down hard on the homosexual community, and they seem to still believe that it's a choice. Well, all the scientific evidence shows that you're basically born gay, and there's a reason for that. And I've got some of the scientific evidence why a certain small percentage of the population is gay, and it's actually it's a bit complicated, but it's discussed, I think, quite well in the book. And so we shouldn't criticize that, and we shouldn't, certainly they should not be ostracized. And there's stuff like a parent will be really annoyed at themselves.
I just have to tell you,
Yeah.
see, I'm in the Gay Pride Parade every year.
Okay.
Have been for years. And I have all sorts of gay clients and
Yeah.
gay friends. And
Yeah.
I'm dealing with another part of it right now. I have 3 gay couples getting divorced.
Oh, yeah.
And their divorces are more complicated than a heterosexual couple with 3 kids. Okay? Because it's a different, and you've got your friend of Richards, our producer over here.
Yeah.
Now this man, just for the record too, was the first person in Canada with his partner Stuart Lynn to provide commercial internet services to Canadian.
Yeah.
First person, that's it right there, number one,
good.
Richard Bitt. And he's also the guy that looks after all the cameras for David Hancock.
Yeah. Oh, yeah.
And that's just why you're here, because this is Hancock as publishers.
Yeah.
So you've done real well in my estimation, because you talked about Native Indians and stuff.
You can read that.
And you've talked about, now you're talking about the gay population, because I agree with you.
Yeah, and you know, parents will be quite upset because one of their kids grew up and was a criminal, and they'll blame themselves. We didn't do this, didn't do that. Well, some of the people are born psychopaths, and they don't have humanity, they don't have feelings for others, and of course they'll get into all kinds of trouble. But it isn't necessarily the parents' fault. I think the parents have a big influence over children, but when the kid's an out-and-out psychopath, I mean, there's nothing you can do about it.
Kids, it's your mental. You can do. Dr. Paul Swingle here in town is an ex-Harvard professor and a very good psychologist, and he cures ADD and cures dyslexia and cures a whole bunch of stuff using neurobiofeedback and things that he's developed. And he'll be the first person to tell you that. He can do a brain scan and tell you you're going to be you have a cocaine addiction personality, you had a sexual trauma in your life someplace, he can just take a look at this brain skull map that he's done and tell you all these things. I'll have to get you a copy of his book too, because it's called It's All in Your Head.
We see, some kids are mathematical geniuses.
Yep.
And I had an older brother like that. And some people are really good in language, and I was always crappy in language. I had a tough.
Me too.
Tough time. But everybody has different talents, and so we shouldn't blame ourselves. And the other thing is we should be tolerant, and so often we're not, because this kid can't learn something, and it's only been recently that they had found out about dyslexia.
Yep.
And I had a friend that was dyslexic, and I could understand why he couldn't seem to read or write, because he was smart, Just talking to him, he knew all the answers to things, but he just couldn't read or write. And we didn't know about dyslexia.
What happens with dyslexia and common ADD and ADHD is that child, I have one in that situation, that child, if they're smart enough and they'll sit at the front of the class and they learn everything orally. And they're fine until they hit grade 11, and then suddenly they have to do written exams and this type of thing. And when they read the question, by the time they go to answer it, they can't remember the question. When they read a paragraph, when they read the paragraph, they can't remember it, or they have difficulty reading it. And that's just one of the things.